I'm Rizal Academia and I'm a nursing student from University of Visayas. So now I'm going to perform the segment 1. The head and face, the eyes, the nose, the mouth, and the ears. So first, we have to do the head and face. So the first step is inspect the face of the patient. It should be, make sure it should be normal in size, shape, and it should be symmetry and contour. So and the second step is look at the patient's hair. And after that, see if the hair is too. The second step is check the hair of the patient and look if it is not too dry and too oily and free of nicks. So the third step is palpate the patient's scalp. So mommy, I get this short. So palpate the patient's head. It should be clean, mobile, and free of lesions. So the next step is palpate the temporal arteries of the patient using the middle finger and the index finger. So use your both hands and feel if the pulsation of the patient is equal. And after that, after you feeling the pulsation of the patient, check if there is any bruise. And use the bell of the stethoscope. So it's normal because we don't hear any bruise. So the next step is palpate the temporal arteries of the patient using the middle finger and the index finger. So use your both hands and feel if the pulsation of the patient is equal. And after that, after you feeling the pulsation of the patient, check if there is any bruise. And use the bell of the stethoscope. So it's normal because we don't hear any bruise. So the next step is press the thumb in the inner aspect of the orbits. So palpate. Do you feel any pain, ma'am? No. This? No. This one? No. So the next step is press under the zygomatic bones to palpate the maxillary sinuses. Do you feel any pain? No. This one? No. Okay, that's normal. So the next step is palpate the temporal mandibular joints of the patient using the middle finger. So ma'am, can you open your mouth? Yes, mouth. Do you feel anything? No. So that is normal. So now you have to instruct the patient. So ma'am, can you raise and lower your eyebrows? Okay, good. And then the next step is, can you bare your teeth, ma'am? Like, okay, that's good. So the next step is smile broadly and puff up your cheeks. Good. So, ma'am, can you close your mouth? So it is normal. So the next step is, if patient complains of face problems upon assessment, test sensory portion of the facial nerve by having her identify sweet, sour, bitter, and salty substances. So after that, so the next step is instruct the patient to close his eyes. So ma'am, can you close your eyes? So instead of cotton, we use towel. So ma'am, do you feel anything? Yes. Do you feel anything touching your face? Yes. This one? Yes. This one? Yes. So it is all normal. So that is the head and face assessment. So after the head and face assessment, let's proceed to eye assessment. So first, test the patient's visual acuity by using the Snellen eye chart. So this is the Snellen eye chart. So ma'am, can you stand up? Sure. So with the patient standing 20 feet away from the chart, so instruct the patient to keep both eyes open and cover one eye with a card and read aloud the smallest line of typed letters in the chart. So ma'am, can you close your eyes? So open your eyes, ma'am. Can you read the pink line? Read it out loud.
DEFPOTEC.
Okay, very good. So close your eyes again. Open your eyes, ma'am. Read it out loud, the pink line.
DEFPOTEC.
Okay, ma'am, you may sit down. Note the lines numerator. This is the distance of the patient from the chart. And the denominator is the distance in which a patient with normal vision can read the line. So the denominator is the Fourier division, and the larger denominator is the Fourier division. And the next step is record each eye and note if the patient was wearing glasses during the test. Step is inspect the patient's eye and external eye suction. So I'm going to move a little bit. So they should appear symmetrical and the eyebrow should be free from scaling. The upper eyelid should be partially cover the eyelids and the lashes should turn outwards. So observe if this is symmetrical. It's okay, it's normal. So the next step is test the patient's oculomotor nerve by asking the patient to close his eyes. So ma'am, can you close your eyes? Sure. So by closing the patient's eyes, you will not, the eyelid should move symmetrically without tremors. So the next step is gently palpate the eyelids for nodules and tenderness. So okay, good. So ask the patient to open his eyes and look up as you invert the lower eyelids to inspect the lower conjunctiva. They have the patient look down as you inspect the sclera and the upper conjunctiva. So ma'am, can you look up? So her lower conjunctiva is pink, which is normal. Can you look down, ma'am? So the sclera is white, which is normal, and the upper conjunctiva is pink and normal. Step is palpate the lacrimal apparatus by gently pressing below the orbit. So can I get your eyeglass? Sure. So after that, so place your finger 12 inches away from the patient's eyes and instruct him to watch your finger as it moves to upper right, far right, lower left, far left, and upper left. So ma'am, follow my finger. Okay, very good. So the next step is in testing for accommodation. Hold your finger 4 inches from the patient's nose. Then ask him to look at your finger, then at the wall behind your back. and then breathe in. So ma'am, watch my finger and look the wall behind me and back and look back my finger. So the next step is perform cover and uncover test. While the patient stare at the wall behind the examiner, have him cover one eye with the card, then observe his uncovered eye. It should not wander or move. When the card is removed, watch the covered eye. It should not move. So, Mama will cover your left eye. So, look straight. So, the other eye, look straight now. Okay. So after that, the next step is inspect the patient's cornea. Test his corneal light reflex by instructing the patient to stare straight ahead while the examiner shines a light on the bridge of the patient's nose. So 12 inches away from the patient's face. So after inspecting the patient's pupil, check the patient's pupillary light reflex, which assesses the optic and oculomotor nerves. To do this, darken the room and shine your light on the pupil from the side. Normally, this causes both pupils to constrict. So I'm gonna close the door so that it will darken. Go. So now I'm going to do the ears. So first step, inspect and palpate the ears. It should be symmetrical with no swelling, lesion thickening, and no pain. And the second step is palpate the mastroid process behind the ear. So you should palpate the ear. So sir, do you feel any pain?
No,
Do you feel any tenderness?
no.
So after that, after palpating the mastroid process behind the ear, perform the otoscopic exam. To examine the patient's ear, hold the otoscope in dominant hand between the thumb and the finger. Pull the pinna of the ear up and back and straighten the ear canal. So since we don't have any otoscope, we use a pen light. So after that, inspect the external ear canal. You should not see redness, lesions, swelling, or exudate. So examine the tympanic membrane. It should reflect the otoscope light and should appear shiny and gray. Its center should be concave with no perforations, and note the malleus and the light reflex and examine the incus. So assess the patient's hearing by performing the voice test. So for the voice test, gently occlude one of the patient's ear with your finger, then test the other ear as you stand 1 to 2 feet away from him while asking the patient to close his eyes. Gently wiggle your finger with ear while whisper a two-syllable word. The patient should be able to repeat the word you whispered. Sir, can you close your eyes? So I will cover your ear. Can you hear me, sir?
Yes.
So that's good. Now let's proceed to the nose assessment. So first step, briefly inspect and palpate the external parts of the patient's nose. So it should be fairly symmetrical with no lesion and deformities. So, ma'am, do you feel any pain?
No.
So inhale, exhale. So I will close the other side, ma'am. Inhale, exhale. So, if patient reports an impaired sense of smell, test the olfactory nerve by having the patient identify specific smell with his eyes closed. So, as he opens one nostril at a time, pass the aromatic substance under the uncluded nostril. So, ma'am, can you close your eyes? Do you smell something?
Yes.
What is it, ma'am?
It's tea.
Yes, good. So, so what about this one, ma'am? The other side.
Yes, it's a tea.
Okay, that's good. So, now let's proceed to mouth assessment. So, first ask the patient to bite down and bare his teeth while assess for jaw alignment. So, before examining the mouth, ask the patient to remove his dentures if he's wearing them. So, the patient don't wear any dentures. So, let's proceed to the inspect the mouth. So, sir, bare your teeth. Right. So, the next step is inspect the patient's lips. So open your mouth, sir. Close. Open. Close. After that, assess the oral mucosa by using a tongue blade and a light source. So, open your mouth, sir. Next, assess the patient's teeth and gums. So, adults have 32 evenly shaped teeth. So, open your mouth, sir. Open lang, sir. So, the patient have 32 evenly teeth. So, inspect the rest of the oral cavity. So, sir, open your mouth. Is inspect the tongue. So the dorsal surface should be symmetrical and slightly rough with a midline groove and small fissures. So sir, can you... Okay. So using a gauze pan, hold the patient's tongue to one side and palpate the floor of the mouth. So sir, can you lick your tongue? Next step is ask the patient to stick out of his tongue. Sir, can you stick out your tongue? Stick out, sir. So the tongue should be it should be midline and free from tremor. Place the tongue blade at the side of the tongue and ask him to push it away. So sir, can you open your mouth? Put your tongue to this side. And this side. Check the glossopharyngeal nerve and vagus nerve by depressing the tongue and having the patient to say ah. Sir, can you open your mouth? Stick out your tongue. Say ah.
Ah.
Ah. So instruct the patient to say ah again and assess the pharynx and tonsils. The mucosa of the patient should be smooth and pink. So sir, can you open your mouth? Say ah.
Ah.
Ah. So if the patient reported an impaired sense of taste during the health history, assess his facial nerve and glossopharyngeal nerve by having him identify different flavors. So I don't see any impaired sense of taste during the history. So let's go to lightly touch the back of his tongue with a tongue blade. So you can see the patient gags. So the test assesses the glossopharyngeal nerve and vagus nerve.